As she goes for a walk, she lives near the downtown airport. She finds herself a bit disoriented, and in the context of that disorientation starts to rely on an avatar of her daughter again, this time appearing on her wristwatch, able to ask her why she's paused and continuing to now walk in small circles. That conversation she has with her watch sees the system provide her with a sense of her current location using both the GPS in her cane and also her mobile communication device, her wristwatch. And then using her contact lenses provides her a way to have direct route directions back to her home. The watch sells today by LG as a video conferencing watch for $450. The contact lenses you see up here are in development by Carl Zeiss and are intended to provide direct retinal projection of video images onto the back of the eye. There is other research going on active in several universities looking at using the eye as a means by which you can gather pulse as well as blood pressure data using contact lens systems. So in the context of this particular scenario, if I go back one particular slide, this you may recognize as also Google Latitude. This is how my children know where I am in the world when I'm outside of the country. Gives them the way of playing video games with maps. Where's Daddy today? And in the context of her arrival home, Mrs. Jane Smith picks up her home management console and based on her disorientation that particular morning is immediately called by her case manager who suggests that her medication will be reviewed with her later that day with her clinician. Her clinician calls her later that day and over the video conference phone presents to her some additional data based on her medication history and performance information and adjusts her care plan accordingly. This particular phone was demonstrated as a video phone at the Consumer Electronics Show this past spring, and the film used between the two parts of that foam is part of the new e-paper technology. I just put a sexier graphic on top of, but essentially it allows for mobile displays to be embedded in a variety of other things. Part of what I'm showing you here in the context of these particular pieces in this little story is that these technologies can go a long way quickly. We can quickly dream how they all interconnect. The critical aspect of how we see them applied, however, do face very fundamental challenges we'll be talking about this afternoon in the context of who will pay for these technologies. What does this do to scope of practice? What are the bioethical implications of these things? What does this mean from a workflow perspective? How do we also address the change in our care delivery models? So in the context of these models, all of those other issues in my mind are far more complex, far more challenging for us as technologists to be aware of and cognizant of. So I put this picture out at 2035. We may have the technologies in 3 to 5 years, but by training I'm a lawyer. And I can tell you realistically, my perspective is that it will take the rest of our society another 25 years to catch up to the dreams and the capabilities that are present in this room today and the technologies we will have available in the next 3 to 5 years. So to back up a little further and talk about where we are from the vantage point of that model from Kanata, because right now as a startup company, I'm living at that valley of death between having the idea, producing the prototype, and having the big viable business. We have gone through over the course of the past several years with this particular watch, which is able to take your pulse through sensors at the back of the watch, the ability to prove out clinical efficacy. We're now at a point where we're negotiating purchase orders to start manufacturing on this particular watch. The original technology tied itself to a base station unit physically housed in the home. We're now tying it to mobile phone devices. The primary channel for a lot of these technologies into our care systems will be supported substantially, I would submit at this stage, by telecommunications carriers who have the wherewithal to penetrate the health systems market. We've also been starting to integrate a variety of other technologies with various partners, either existing 501k market cleared devices that are Bluetooth enabled, as well as other software applications that have gone through some of their now required Class 1 medical device certifications, as software is now considered a medical device where it touches health data. And also tying that together with other small devices. This is a fall monitor that can be clipped to your belt, developed by a partner of ours in Japan. So in the context of all of these particular technologies, we're backing up from this vision to being very focused on what's practically possible now. Really a device or a small subset of devices integrated into broader organizations that allow for interoperability to get real actual application and traction in the marketplace is key. And pardon me, continual alliance is one of those organizations, and clearly also a nice success story here in Alberta, with where we can see further development of other communications protocols that will expedite a lot of the exciting technology being developed here. Thank you for your attention this morning, and I'll be delighted to talk with you later. Thank you, Tom. Do you have any questions for Tom? Yes.
Just one. I'm the time guy. Just one question. Somebody tell me.
Oh, sorry. Okay. Anybody have one question?
Okay.
I guess one of the challenges to being the technical side of the world, I can see the coolness of the technology. One of the challenges from a technology point of view is it really a step forward if you compare it to sort of the quote-unquote old-fashioned way of doing things? And have you had a chance to sort of look at that differential?
Absolutely. In fact, this has been really well studied and documented. Canada Health Infoway, the organization that's been underwriting a lot of the automation of our health system, has identified this area as a place where we could reduce chronic care management costs by up to 45%. Today, those chronic care costs consume 80% of all of our healthcare resources. So I think there certainly is market value to this, and there certainly is reasons to make that kind of change.